don't want anybody to feel uncomfortable around me based on my behavior. But I was grumpy. I just couldn't get happy. I couldn't sleep well. I couldn't sit at the table to have dinner. I couldn't converse with people. I could not relieve the pain no matter what I did. Well, my name is Joe LaMotta, 49 years old. Got a family of 6. I've got 2 in college, 1 junior in high school, and a 6th grader who we adopted from China. Right now, I'm Chief Business Officer for a company called GE Walker. So we sell X-ray, any kind of radiographic equipment. I've been extremely active my entire life. Early on, even in my early 20s, I had some symptomatic pain associated with my neck, but eventually it just caught up with me. So about probably the fall of last year, I started feeling some discomfort in between my shoulder blade and my spine. And it would go away and it would come back. So then by February, my wife and I were on vacation in Savannah and we were doing a 5K run, and the pain was starting to go into my arm, and it was painful. I started thinking something's really not right. Pain was probably a 10. And then one day at the office, I went to actually push up out of my chair, and when I went to push out of my chair, my arm gave away. That scared me, quite frankly. I mean, because I knew what that meant. At that point, it was affecting my daily life. My wife actually, she says, the kids are coming up to me asking me if you're okay, because your demeanor's changed, and I didn't even realize it. I had no idea that the way I was behaving, I thought I was keeping it inside, but eventually to everybody in the family, they were like, something's not right with him. I apparently was just walling myself off, and they were noticing it, and I didn't realize it. So I immediately picked up the phone and called my surgeon. And nobody wants to have surgery. I was scared to go into the surgery, quite frankly, like anybody would, to whatever degree. So I talked a little bit about the procedure with my surgeon. He just basically told me, he said, listen, if it were me, I would have a total disc replacement. Literally that day after the surgery, they said, Joe, do you want to stay the night? I said, no, I'd like to go home. I'd rather not stay in the hospital. I was already driving the nurses nuts. I was walking around the nurses station probably 100 times. And I went home that night. The next day I walked around the neighborhood, which was about a 3-mile clip with my wife. By the 5th day, I started jogging lightly. Yeah, so I would say about 5 months or so, 6 months into my recovery, I was pretty much at full speed. One of the biggest positives coming out of this actually was it was a great lesson to my children, honestly. I had one of my children home who's now in college. She actually sat in the hospital with my wife. So once she saw me come home that night, and then she saw me at the gym a week later, she went to the gym and saw me turn up the speed and start to jog. I think it just hit her like, wow. In hindsight now, the way everything's worked out, I without a doubt would do this 110% over. I'm in a great place right now.